You went through a high stress period and found a way out by utilizing things to improve yourself and your kitchen from the inside out. That's amazing. So powerful. And your chapter is so powerful. So without giving it away, but how do you incorporate lifestyle medicine into your practice now? You mentioned, it's changed the way you practice medicine.
Right. Well, as I said, I'm a pediatrician, so I work with children from 0 to 18, and that means I work with parents a lot too, right? Um, and so, I think the advice really hasn't changed because we're always talking about like eat your vegetables, get some exercise, get good sleep. But I think that the way I deliver it is different, and the way that I show up in my visits are different. And so, as an example, before with kids, a lot of kids don't like to eat vegetables, right? And so, I tell them, okay, you can eat your vegetables, try to get this many servings a day. And then it was kind of like, okay, yeah, right. And the next time I see them again, are you eating your vegetables? No, right. So now the way that I do it, because you kind of learn a little bit about how to do like more of a coaching style and motivational interviewing, like as part of the lifestyle medicine curriculum. And so now I ask my kids, I'm like, well, is there room for improvement in the way that you eat? What do you think? And I mean, almost always they say there's room. And so I say, well, where do you think there's room for improvement? And they'll say, I probably could eat more vegetables. I'm like, okay, well, if that's your goal, tell me which ones that you like or which ones you're okay with. And they'll give me a list. I'm like, okay, well, maybe can you add one more serving each day? And they'll say like, okay, yeah. I'm like, well, where can you add that serving? What time of day could you add it? And then so they'll come up with an idea like, okay, I can bring carrot sticks at lunch, or I can eat something after school. And then I'm like, okay, that sounds great. What if you did this like 3 days a week this week, like Monday, Wednesday, Friday? Could you do that? And they'll be like, okay. And so that's like, I'm helping them essentially develop a SMART goal. And all of it came from them. And it keeps them accountable because it was their idea. And I write it in the note and I'm like, okay, I'm gonna ask you next time, did you do this? Right. And so I feel like there's more change. And I think even with the little kids, you can do this, but the teenagers as well. And, I've had some kids who've come in with some pretty decent issues, ranging anywhere from issues with constipation or chronic headaches or anxiety, and kind of manage it with like lifestyle medicine type advice. And I'll have them follow up and I'll be like, well, let's talk in 2 weeks or 4 weeks and let's see how you're feeling. And, a lot of times there is a pretty decent change, and it's just great to be able to work with like young kids. There's still some habits that need to be adjusted, especially, with the teenagers. But I think that once they see like, hey, I feel better, and they know what it feels like to feel better, then it's their choice, right? Whether they want to continue that path or they want to go back to the way they were before. And I give them, the freedom to decide for themselves. But I think that approach has been more effective. So that's kind of one way. I do a lot of like one-on-one with my patients. And another way I incorporate it is I have like canned discussions I have at each visit. Like I talk to my parents at the 2 week mark. I'm like, well, how can we teach our baby to be a good sleeper? We're not sleep training yet, but like, are there habits you can teach in the beginning that will help them to be able to sleep well down the road? And then I have a discussion at 6 months about like the impact of like screen time and, mindfulness, and how do you maintain your baby's mindfulness. And we talk about that at 6 months. So I have kind of these things that I know at each well visit I'm going to talk about that's lifestyle medicine related. And that way it's, kind of like digestible chunks, because you can't give all of it at once. That's too much, right? But I just give a little digestible chunk each time, and then we talk about it and opens up conversation and creates intention, which is really kind of my goal.
That is so powerful. I mean, I love that. You're empowering the next generation to choose their own life and lifestyle with each simple little decision, little nuggets of coaching. That's so
Right.
powerful. Wow.